Hi, my name is Peter Lang, and I'm a second year medical student at OSU CHS. Our research was called Bridging the Gap, Improving Data Sharing Statements in Surgical Research, a cross-sectional analysis. Surgery encompasses diverse procedures impacting patient health. With a 31.5 increase in general surgery workload over 2 decades, research on patient outcomes is vital. Data sharing enhances transparency, reproducibility, and evidence-based medicine by advancing knowledge, reducing redundancy, and generating new hypotheses. Despite its benefits, data sharing implementation remains inconsistent. For example, the ICMJ mandates data sharing statements in clinical trials, but studies such as Burgett et al. Show no significant improvements in surgical research transparency post guidelines. In our methods, our cross-sectional analysis followed PRISMA guidelines and was approved by the OSU IRB. Data and protocols were shared on open science framework for transparency. Clinical studies from the top 5 journals dating from 2020 to 2023 were searched in PubMed. Team members were trained on criteria and the Rayon platform with 2 authors independently screening and extracting data. Studies included surgery-related outcomes with new primary data. Exclusions were reviews, commentaries, case reports, and studies without novel data. Data extraction covered biblical details, study design, funding, and data accessibility, and sharing statements. Descriptive and logistic regression analyses assess data sharing trends, while qualitative analysis categorize data sharing statements. Authors with data available on request statements were contacted to evaluate willingness to share data. To our results, out of 1,094 articles from top surgical journals, 12.89% included data sharing statements. Clinical trials had higher data sharing rates compared to cohort studies. Data sharing statements inclusions increased from 8.2% in 2020 to 20.17% in 2023. Government funding was most common, and open access articles had higher data sharing statements rates. Factors influencing data sharing statements included study design and journal impact. Clinical trials in higher impact journals were more likely to share data. Most data sharing statements had control access with conditional access and privacy concerns as common themes. Of 96 contacted authors, 78.26% were willing to share data, with 39.13% able to do so within a month. Below is our graphs of the results that we had. To our conclusion, our analysis reviews a persistent low rate of data sharing statements across surgery journals, hindering data reproducibility. Although there has been slight growth in the inclusion of data sharing statements, actual sharing of data remains inconsistent. Variability in journal and publisher policies highlight the need for mandates and enforcement of stronger policies. Our findings have exemplified the need to improve data sharing practices to advance surgical research. Below is a reference. It's a QR code to our references. And we appreciate the Vassar research team for their guidance in the OSU Medical Library for their resources and accessibility in assisting with this study.